You are about to walk into a facility, or you already have, and somewhere between the lobby and the memory care wing, someone pointed at a number on the wall or on a website, and that number was supposed to tell you everything you needed to know about whether your loved one would be safe there. That number is not what you think it is, and by the end of this video, you will know exactly what to ask instead of looking at that rating, because the question that actually predicts overnight safety is one the industry has spent years making sure families never think to ask. The national average cost of memory care is between $7,500 and nearly $8,000 per month, more than $90,000 per year. Families paying that amount have every reason to believe the 5-star rating on the government's website reflects what happens in that building after midnight. It does not. The rating system used by the Centers for Medicare and Medicaid Services, headquartered in Baltimore, Maryland, allows facilities to self-report their own staffing numbers. The facilities enter the data, the government posts the star. Nobody verifies the math before your family signs. The Washington Post reviewed 160,000 state inspection reports and found more than 2,000 residents who wandered away from assisted living and memory care facilities beginning in 2018. At least 98 died. From hypothermia, from heat exposure, from drowning. The gap between what the rating shows and what the building actually contains is not a rounding error. It is a business model. A peer-reviewed study published in the Journal of the American Medical Directors Association in 2024 measured actual staffing ratios in Ohio assisted living communities against nursing homes. Assisted living communities had 35.6% more residents per aide during the day. Overnight, that gap widened to 65% worse. And nearly 30% of assisted living communities in the study had no licensed nurse on duty overnight at all. Not reduced staff, no licensed nurse. Nearly 30%. That is roughly 1 in 3 facilities. Now consider what Brookdale Senior Living, the largest senior living operator in the country, headquartered in Brentwood, Tennessee, was doing during the same period. The Washington Post reported in April of 2024 that Brookdale built a proprietary staffing algorithm that set caregiver levels by timing workers with stopwatches. Task timing, not resident clinical need, drove the staffing model. They ran the math. They calculated exactly what each minute of caregiver time cost. They built a system to minimize it. They wrote it into a proprietary algorithm. In March of 2022, the California Attorney General, operating out of Sacramento, settled with Brookdale for $3,250,000 over findings the company fraudulently overreported nursing staffing hours at its California skilled nursing facilities to earn undeserved 4- and 5-star ratings from the Centers for Medicare and Medicaid Services. The inflated stars remained on the website while families toured the lobbies. Brookdale is not the only name in this record. Sunrise Senior Living, headquartered in McLean, Virginia, received final court approval in December of 2024 for an $18.2 million class action settlement over allegations its California facilities set staffing based on fixed budgets rather than resident needs. Aegis Living, headquartered in Bellevue, Washington, settled for $16.25 million in 2021 in a case originating in King County, Washington, and the Northern District of California, over a point-based system that allegedly generated higher care fees while staffing remained budget-driven. Emeritus. Corporations settled for $13.5 million in 2015. Oakmont Senior Living, headquartered in Thousand Oaks, California, settled for $9 million in 2020. Atria Senior Living, headquartered in Louisville, Kentucky, settled for $6.4 million in 2016. Combined, those settlements total more than $75 million. Barbara Doyle was 74 years old when she was admitted to Brookfield Assisted Living and Memory Care in Bella Vista, Arkansas. She had been a resident for 3 hours when a staff member saw her leave, disabled the door alarm, and returned to work. Barbara Doyle died of heat exposure. Her family reached a $2 million wrongful death settlement. What this data actually shows, when you look at it carefully, is not a series of isolated compliance failures. It is a staffing model every major operator in this industry adopted, and a rating system that made it financially rational to do so. When the government rewards self-reported staffing data, the incentive is not to hire more staff. The incentive is to report better numbers. That is what the settlement record documents. And that is what your loved one is living inside. If this is the kind of information your family needs, this channel covers the senior living industry in exactly this depth every week. Subscribing takes 2 seconds, and it means the next time something like this comes up, you will already know what to look for. The deeper you go into how the Care Compare rating system actually works, the more one pattern becomes impossible to ignore. The system was not built to measure care quality. It was built to measure reported compliance with documented minimums. The staffing subscore on Care Compare is built almost entirely from data the facility submits itself. No independent verification occurs before that number becomes a star your family relies on. State health. Inspections cover one of the 3 subscores, but state agencies operate on irregular schedules, and many states provide advance notice before full inspections. A facility can hold a 5-star rating while an unresolved state investigation is still open. That is not a gap in the system. That is the system. The $75 million in settlements, the 160,000 inspection reports, the 98 documented deaths, all of it returns to the same proof point. A number on a wall does not tell you what happens at 2 in the morning. Everything before this point is what the industry hopes your family never finds out. What follows is what they are genuinely afraid you will do with it. The overnight staffing ratio is the answer, not the daytime ratio, not the composite star, the actual number of on-duty staff per resident between 10 at night and 6 in the morning. Here is how to find it. First, visit the facility unannounced between 11 at night, 2 in the morning. Count visible staff in the memory care unit and divide by residents. Any ratio worse than 1 aide to 15 residents reflects the documented risk pattern in the Journal of the American Medical Directors Association research. No cost, 30 minutes. Second, request the written staffing schedule for all 3 shifts over the prior 30 days, memory care units specifically. A facility that delays more than 48 hours is signaling something. No cost, 5 minutes. Third, cross-reference the Care Compare star rating against your state's own inspection database. Search for FTAG 689, covering fall and accident hazards, and FTAG 690, covering elopement risk. The gap between those records and the federal star is what you are looking for. No cost, 45 minutes. Fourth, request the written care assessment methodology before signing. Ask specifically how assessed care points translate to monthly cost and what triggers a reassessment. The Aegis Living Settlement documented a system in which that connection was severed. You are looking for whether the contract in front of you does the same thing. No cost, 1 meeting. Fifth, contact your state's long-term care ombudsman before signing. Ombudsman offices carry complaint histories that never appear in star ratings. Federally mandated, free in every state. 30 minutes. The total time investment is 3 hours. The cost of skipping it can be measured in wrongful death settlements. 3 hours is the better trade. Before this video, you were the family the industry designed the rating system for. You are not that family anymore. You now know how the data is collected, what the settlement record says about the gap between the reported number and the building reality, and exactly what to do instead. That knowledge changes every decision that comes next. If your family has dealt with this specific situation, share what happened in the comments, because understanding how widespread this actually is matters. Share this with anyone in your family who is dealing with any of this, and if you want to stay ahead of the industry rather than behind it, subscribe. The next one is something most families find out too late.